Hey, you are welcome to another episode of Health Awareness Tips with Dr. Kalenzi. And today we are doing something very interesting. It's about eye injuries. We are reviewing dangers that you shouldn't ignore when you have any injuries related to the eye. Please stay tuned. I'm right back. My name's Dr. Kalenzi and I'm an ophthalmology resident. I'm passionate about sight. You know, everyone deserves a right to see. And if it's the very first time to watch my videos, please subscribe and like our videos if you find them very helpful. Please endeavor to share with someone and hit a notification icon so that every time I upload a new video, you will be able to be notified. Thank you. Let's get into this video. So 1.6 million people are permanently blind worldwide due to eye injuries. And also, eye injuries contribute to about 5% of all cases of blindness. And therefore, this caused a need for this video so that we understand the danger signs and we know when to seek medical attention. So these are the danger signs. 1, sudden loss of vision. If you get any injuries related to the eye and suddenly you wake up, one eye or two eyes are all not seeing, then this is a danger sign. And it could be a sign that probably you have hyphema in the anterior chamber or bleeding in the anterior chamber. It is a sign that maybe you have bleeding in the vitreous, which we call vitreous hemorrhage. It is a sign, and the biggest sign, that you could have retinal detachment. And therefore, you need to rush and see your ophthalmologist. Number 2, double vision. Seeing two things in one. You may be seeing a cow, you're seeing a car, and instead of seeing one thing, you are seeing two. It could be a sign that your nerves that supply the eye muscles are affected. It is a sign that your nerves, the muscles of the eye are also affected. And it can also be a sign that probably the nerves that come from the brain and supplying the eye are also compressed, and therefore they predispose you to having what you call double vision. Number 3, painful eye movements. Normally, the eye has got different gazes. You can be looking up, you can look down, you can look laterally, you can look medially. So if you are after an injury and any of those gazes or eye movements are affected, then it is a danger sign and it calls for urgent attention. Number 4, we have what you call an ophthalmos. Call it a sunken eye in simple terms, but it is a posterior displacement of the eye, and it is a sign that probably you've got a lot of fractures around the orbit, around the eye orbit, and then the eye is dropping inside because there is no support. There is nothing around to support it. Number 5, we have what we call exophthalmos. This is forward displacement of the eye. Another person will call it proptosis. And this is a sign that probably posterior or behind the eye, there could be bleeding and it is pushing your eye to go in front. And this bleeding compresses on the optic nerve, on the nerve that supplies the eye, and it can also cause your loss of vision. And also, when your eye now gets proptosed or is now moving forward and is no longer covered by the eyelids, then it is prone to what we call exposure keratitis, because the eyelids are supposed to close and spread the tear film all over it to keep the cornea hydrated. But in the cases whereby it is pushed forward, there is no more protection and therefore it is prone to dryness. And that's a very dangerous sign also. Number 6, we have foreign body in the eye. Foreign body can be any matter. It could be a glass, it could be wood, it could be part of the stone, and this can be stuck either in the conjunctiva or in the cornea, or actually they may penetrate into and go into the anterior chamber. The take-home message on this foreign body thing is do not try to remove it for yourself, because you're going to cause worsening injuries on the cornea as well as bleeding in the eye. And therefore, the easiest thing and the most important thing you should do is rush to the health practitioner, to an ophthalmologist, for them to be removed. Number 7, we have what we call ptosis. This is drooping of the eyelids. This could be a sign that you probably have damages to the nerves that supply the eyelids, the upper eyelid. We have corneal lacerations. These are just abrasions or cuts through the cornea, and the cornea is an important part of the eye. It is a window through which light rays come and go through. It is a glass just. So when it is cut, now the pathway through which the light rays should enter through the eye is cut off, and it can lead to severe blindness, because over time you get corneal opacity, like the glass now goes off, becomes white, and no more light will be able to go through. So I told you that they could be superficial and those ones are mild, but we have those deep tears or lacerations or cuts in the cornea that are really blinding. What is the take-home message?
Then we have what you call lens displacement. So normally the lens is placed at the center of the eye. But in some patients, when they get injuries, the lens tends to be displaced. It goes out of the way, like it can go superiorly, it can go inferiorly, it can be medially or laterally. It's true somebody can live without a lens, yes, but again, sometimes it drops into the anterior chamber and causes pressure, or even cross the anterior angle of the eye, where there's always drainage of the aqueous humor. So once it breaks this way, then patient is prone to high pressures of the eye. And this is also very dangerous because it tends to cause you to have an acute glaucoma, which leads to optic nerve damage. And this is also very dangerous to the eye. Of course, it's blindness which is not preventable. So going for review when you have such a case, when you note that something is wrong with your eye after injuries, don't sit home, just rise up, go and seek for medical attention. And then number 10, we have damages to the puncta. So normally the eye is blessed with 2 holes, and these holes are on the upper and lower eyelid medially, and they are supposed to drain tears when they are produced from the lacrimal gland, and then they flow down all the way to the nasolacrimal duct in the nose, and they drain. Therefore, when you get injuries to this puncti, or the holes in the eye, in the eyelids, it makes you have what you call epiphola. You have tears dripping all through, and this makes patients prone to dry eyes. Another
My take-home message is, can we please make use of protective gears for any activity you're doing? Please, the eye is so precious, for heaven's sake, and therefore you have to protect it if you do not want to live either with one eye or actually living with permanent blindness. This is a call for the parents. Dear parents, protect our little children from eye injuries. These children are always very innocent, and sometimes they do not know that maybe playing with sharp objects would affect their vision. Take away every other sharp objects from them, discourage them from having sports that involve fighting with stones and other things that could really make them prone to these injuries. Otherwise, thank you very much for watching my videos. I'm so grateful, and I hope this video helps you always to identify danger signs of eye injuries. Do not leave to subscribe, like our videos, and of course, share with a friend. Thank you. Until next time.